Investigation to manage. So what are the investigation we offer to the patient coming with a back pain or sciatica? The first one is the x-rays. X-rays not on the first day, but if the patient history is more than one month or 6 weeks, so you can go for the X-ray. But here in our practice, we do the X-ray on straight away because patient comes to us with a history of couple of months and some maybe years. So we do the X-ray first and then see if there is any information. MRI basically is highly sensitive and specific, but unfortunately there are high rates of abnormal findings on MRI in normal people, and you will be astonished to see the in the literature that see this slide now, that in the cervical spine 5 to 35% of disc herniation and bulge in the asymptomatic patient. It is an asymptomatic patient and did the MRI of the cervical spine or lumbar spine. And in the lumbar spine, if you see 68 to 96% of the disc degeneration and 50 to 84% of disc bulge. So here comes the point that when the patient is complaining of the back pain and saying the pain is going down the leg and there is a disc bulge, so we surgeon, we advise them for the surgery, which is not the proper way. I'll come later on in the presentation that what are the ways to treat this patient, but this is very alarming that MRI show the false positive in the asymptomatic patients over the age of 40. False positive. These are the literature full of studies saying about the fracture. Now look at this slide. If you see the imaging findings, the disc degeneration, signal loss, height loss, disc bulge, protrusion, annular fissure, facet degeneration, spondylolisthesis. So these ranges from 3% to 96%, but rather 37% to 93%. So you can imagine that, but it's unfortunate because sometimes the patient comes and they himself ask that what I these are the names known in the community that MRI. Sometimes the patient bring the MRI with him and I say, who advised you? So he said, Dr. Sahab, aapne karni thi, to isliye humne khud kar li. So this need to be spread, virally spread, that we should not go for the MRI because MRI is not a diagnostic investigation. Please listen to this, that MRI is not diagnostic investigation for the back pain or sciatica. It is a planning investigation. When we decide that we are going to operate this patient, then to plan that which level we are going, which side we are going, then we do the MRI.